like at this time to invite to the stage Dr. Deborah Trautman, President of the American Association of Colleges of Nursing, to accept this award on behalf of Elaine and on behalf of nurses and nursing students everywhere. Before I give up this mic, I have to say to Anna, that invitation is a real one. She said, I don't make empty invitations. Tell her I want to have dinner with her.
Good evening. As the Chief Executive Officer of the American Association of Colleges of Nursing, the voice for academic nursing, it is truly my honor to be here tonight to accept this award on behalf of Elaine Adler and for nurses everywhere who share her commitment to infusing humanism into healthcare. Since the origin of the profession, and I get choked up because it's so true to our roots, nurses have recognized the great impact that a strong concern for human welfare, coupled with the knowledge of science, can have such a significant impact on the care of patients, on the care of families, and for communities. Elaine and her husband, Mike, they understood this connection and the invaluable contribution that nurses make to health and well-being of all. 5 years ago, AACN and the Gold Foundation announced a bold new partnership. They would introduce the white coat ceremonies, as you've heard, for nursing. These ceremonies have been a long rite of passage for students entering medical school. But now, as you heard, we would be presenting these at nursing schools due to the generous support from Myron and Elaine Adler Private Foundation. Elaine and Mike Adler were convinced that the success of humanism in healthcare, while resting on the shoulders of many, could and would not be successful without nurses. The Adlers' public and their personal experiences, as she shared, gave them firsthand knowledge that patient-centered nursing care and patient-centered care matters for all. In a press statement that was released to celebrate this milestone in nursing, AACN underscored inviting nursing into this initiative sent a clear message that all health professionals have an essential role to play in providing compassionate care. It's all of us. We applaud our colleagues at the Gold Foundation, as well as the Adlers, for supporting this visionary effort to promote excellence in healthcare delivery and in interprofessional engagement. As you heard, since 2014, the Adlers have provided continuous support to nursing schools to offer these white coat ceremonies. To date, nearly half of all the nursing schools in the nation that offer baccalaureate and graduate education, 360 academic institutions now offer these white coat ceremonies, which require the incoming students to commit to providing compassionate care from the start of their clinical nursing education. I myself have had the privilege of attending many of these ceremonies over the years, and I have witnessed firsthand the impact that these events have on the professional formation of future nurses, but equally so, their parents, friends, and families that join them at these events. Nursing will forever be grateful to Elaine Adler for her commitment to shaping the future of healthcare and for elevating patient care experience to be the best it can be through humanism. I know that if Elaine were here, in addition to recognizing and being appreciative of this award, she would also like to thank and recognize the other awardees. So on her behalf, I would like to recognize the other recipients for the awards tonight. And as you've already heard, author Anna Quinlan, who I do not know, but I'm happy to join for dinner if you go. I'd love to do that. Thank you so much for all that you have done to shape the national dialogue about the need for compassionate care. And then a great colleague of mine and a dear friend to AACN, Dr. George Thibault. Thank you. Your leadership has been extraordinary. You have led groundbreaking work that has advanced interprofessional education, practice, and it is transforming care and education across the nation. Tonight's honorees indeed are making a difference, a real difference in improving health and healthcare, for which we are all grateful. Thank you very much.